Well, our investigative team looked closer at data on wait times of the Valley's VA medical centers.
Channel 5's Matt Riss learned that Valley veterans are waiting longer than the reported averages. Matt.
We scoured through these records. Overall, there is a downward trend when it comes to wait times for existing patients. But for new patients, they can expect to wait as long as 70 days for care.
Texas Valley Coastal Bend, this is Nora. How can I help you?
The Texas Valley Coastal Bend Veterans Administration booked over 235,000 appointments from last October to October 2017. That works out to just shy of 30,000 patients churning through the system.
We have radically changed the access for our patients.
Jorge Ortegon is chief of medicine for the Valley Coastal Bend clinics. He shares what happens if patients face high wait times.
The health of the patient will, deteriorate.
We wanted to find out exactly how long Coastal Bend patients are waiting. We pulled data from the VA's government website. As of September 1st, patients waited an average of 5 days for primary care, 5 days for specialists, and 2.5 days for mental health in our region.
Well, fortunately, we've done a really good job in gaining the trust and credibility back with our patients.
The data showed it is difficult for veterans to get certain types of care in some places. In July, veterans at a Harlingen clinic waited an average of 13.5 days to see a specialist. The September 1st numbers show gains. Veterans now wait at that clinic just over 10 days. Corpus Christi and Laredo veterans faced waits longer than overall averages. In July, Corpus veterans waited 10 days to get primary care. In Laredo, it took 8 days to see a specialist.
Our challenge here is actually having some of those specialties on board.
As early as 8:15.
Perez said they streamlined many processes to reduce wait times. Veterans can directly opt into the Choice program and choose an outside provider if wait times are clocking over a certain number of days. If you're a new patient, expect to wait as many as 70 days to get specialty care at the VA. Here's a breakdown of new patient wait times right now. In McAllen, for primary care, you'll wait 24 days, compared to 16 in Harlingen and just 12 at its Treasure Hills location. When it comes to specialized care like gastroenterology, it takes 27 days. To see an audiologist, a 70-day wait. Perez said that number is an exception.
Those are really good compared to what I've personally experienced out in the community. From my own personal experience, I had to wait a few months for my primary care appointment out in the community. If I could have something at 24 days, that would be awesome.
Perez said wait times rise when patients miss or forget to cancel appointments.
Hi, Mr. Garcia.
He also said wait times can be a testament to the quality of care they provide.
We do have a number of patients that choose to wait a little bit longer to be seen by us. Obviously we know their background, we can relate to them, we're veterans ourselves, so a lot of it is by veterans' choice.
Veterans like Hilario Diaz make that choice every day. Diaz turned the pages of a scrapbook jogging memories of his service in Vietnam.
I'm thankful to God that he brought me back.
Diaz said he is satisfied with his experiences at the Coastal Bend VA.
Where in the valley can you go to and not have to wait to see a doctor?
He did not wait long for care.
It's free. I haven't researched anything, but I would venture to say that there is no other country in the world that does for their veterans what the United States of America does.
Because I need help, I need support.
Army veteran Robert Grandstaff shared a different experience with the VA. He was injured while deployed.
I said, I need a lot of care. I have a lot of physical injuries, PTSD, chronic back pain.
He said he waited for his first VA appointment in 2013.
When I first moved here, I had asked for an appointment, and they told me that they were pretty backed up, and that the initial wait time would be 3 to 5 months before they can get me in.
Grandstaff said he requires a lot of specialty care because of his injuries.
Just like other veterans, then I'm going to have to find outside care.
Change is what he hopes for.
There needs to be some sort of better system, some better accountability.
Back in 2016, the local VA was scrutinized after an allegation of altering data to make it look like veterans were waiting less for appointments. Perez said it happened at clinics across the country and is no longer an issue.
It was a national initiative to do training and retraining of everybody that had the ability to schedule within our system. So, and that continues annually.
Perez admits wait times will constantly change. A new patient survey will be a crucial measuring stick to find out how satisfied or dissatisfied veterans are with their care. If you want to find out about wait times at clinics like this one across the region, you can head to our website, krgv.com. Just look for this story under the links section. Now, we did notice some discrepancies between those times and the times that we've seen in VA reports online. Perez said that's because the data changes every day. In Harlingen, I'm Matt Rist, Channel 5 News.